Dr. Bell was raised in El Paso, Texas. She obtained a BS in molecular biology from the University of Texas at Austin and attended medical school and completed her internal medicine residency at what is now the UT Health Science Center at Dallas. She subsequently served as an epidemic intelligence service officer for the Center for Disease Control and Prevention. Her experience at the CDC led her to change her career plans from infectious disease practice to public health. Dr. Bell has worked for DHEC for nearly 30 years and held various positions, primarily involving prevention, control, and response for infectious disease. Health disparities and health inequities has always been a focus of that work. Dr. Bell is currently the director of DHEC, Bureau of Communicable Diseases, Prevention and Control, and South Carolina State's epidemiologist throughout the pandemic. Dr. Bell served as a lead medical advisor in South Carolina, working to provide science-based guidance to help control COVID-19 and endeavor to draw attention to addressing social determinants of health and all public health interventions, including the pandemic response, with the goal of reducing health disparities. Dr. Bell is involved with several community organizations, and she's board of trustees for Adventures, Children's Museum, Healthy Learners, Heathwood Hall Episcopal School, Francis Burns United Methodist Church. Dr. Bell is married to Dr. Myron Bell, a retired cardiologist, and they are the proud parents of 2 young children. Dr. Bell, thank you for joining us, and we are so happy to have you. As you know, this group is about having women step into leadership roles. And if you could tell us about what it was like for you to step into those leadership roles, we would greatly appreciate it. And then we will work towards questions and answers towards the end of the hour.
Well, sure. Thank you so much, particularly for this invitation. From what I know about women in leadership, I really have the highest respect for the efforts to engage and build more women into leadership positions. And so I'm really humbled by being asked. And I did touch base with a couple of people. I wasn't exactly sure what to expect or what was expected of me. And I was uncertain about my experiences that I should convey in terms of what took me into my positions in leadership, if you will. And what I thought most about was actually my earlier experiences that framed the way I look at things, the way I have addressed challenges, and the way I've come into positions. And so actually what has led me into leadership positions were really my earliest experiences. So I just wanted to talk really briefly about some of my early life experiences, and also that really frames the way I see people, the way I treat people. And so it is from my early life's experiences, and then later on, and actually observing and working with people who I either admired and respected or who I didn't, that I learned a lot from, and how I have conducted myself and chosen my career paths. And I do want to say just a bit actually about my parents. It really framed my background, because as my parents, Black people, both of them born in the 1920s, and how the world treated them really shaped what they became, and that shaped what I became. They had really dramatic differences, and my father was originally from Brooklyn, New York. My mother was born in South Carolina, raised in Florida, in what my father saw as the Deep South. And so I was framed by this, 2 parents, a Northerner and a Southerner, but I was raised in El Paso, Texas, as you mentioned, in West Texas, that was not really influenced by the South. So in my early experiences, I had so much diversity in my childhood that this had a lot to do with framing how I recognized where people came from, the similarities and differences in people. And it was a really a rich cultural experience that I wanted to mention, because in El Paso, Texas, the West Texas is not anything like the South. It is the westernmost tip of Texas, and it's on our U.S. border with Mexico. And my mother was a teacher. She taught at St. Patrick Cathedral School. And even though my brother and I were not Catholic, we attended this school because my mother taught there. The school that I attended was actually on the other side of the mountain, the southernmost tip of the Rockies where I lived. And it was from where I caught the city bus to go back and forth to school from home when I was in middle school. My bus stop in the downtown plaza in El Paso, Texas, was literally a 15-minute walk from the Mexican border. And so where my school was located, an elementary school, was in a very poor neighborhood. About 95% of the students were Mexican American. Many of them, their parents were first generation Americans. And so when I was in elementary school, all of my friends were Mexican American. My brother and I, throughout my elementary experience, 1st through 8th grade, were one of only 3 Black families in that school. So all of my friends were Mexican. We were not Catholic, my brother and I, but we attended Mass every Friday because that was required to attend school there. But we lived on the other side of town in a predominantly white neighborhood. And so all my friends on the street were white. So I had this diverse background, and it was really when I went into public high school that diversity really blossomed. It was a very rich experience because in El Paso, it's a huge military town. My father was actually in the military, which is what took me there. Took our family there. And so in school, it was a very diverse makeup, racial makeup, socioeconomic racial makeup. And in fact, because this was such a big military town, there were a lot of soldiers who had served overseas who married foreign-born women. And so a lot of my friends were interracial. So this was a really unique experience for that time, that I attended school with people of all different backgrounds, and we actually got along quite well in all of these experiences. So when I look at the way things are now, it just tells me that if you let children be children and they just see each other as friends and not anything different from that, and don't recognize a lot of differences in people, that really significantly framed how I saw the world. And you know, both of my parents were very well educated. In fact, my mother was a teacher, as I said. My father was in the military. He was actually quite brilliant, a brilliant mathematician, but because of what was available to his family, he joined the military when he was 19 years old and actually fought in the infantry in World War II and in the Korean conflict, and then came back to this country to be told where he could not eat, where he could not sleep. And so each summer, my family traveled both to my father's home in Brooklyn and my mother's home in Jacksonville, Florida. And so my childhood experiences were of my family members in the North and the South, and of this rich cultural experience in El Paso. And so all of that just exposed me to a lot of different cultural experiences. And it wasn't until I attended college that I actually became aware of really discrimination, segregation, and racism. I was really surprised when I went to college to learn that many of my Black friends had lived in all Black neighborhoods, had attended, you know, predominantly Black schools. And I couldn't imagine how that kind of segregation still existed in the 70s. And so where they came from Houston and Dallas, which was more like the South, and we're still often told that there were certain places that they shouldn't go after dark in small towns in Texas because lynchings were still occurring in some places in South Texas. I also look back on those experiences and understand how, as a child, I saw all of these cultural backgrounds as people who were simply my friends. And then I'm not sure how to describe this, but in a way, when I attended college and began to experience segregation and separation, and in fact racism, that people begin to be poisoned by socialization, and that sort of ultimately framed how I began to move my public health career into really focusing on health disparities, even though I really focused my career on communicable disease control. And I want to relate one particular experience because my parents expected a great deal of both my brother and I, really highly valued education, but my father in particular expected us to be very self-sufficient. And so one example that I'll give of what sort of was like many life's experiences I had is that my father said that I could not drive a car unless I learned how to fix a car. And so he expected and taught me how to change my oil, gap my spark plugs, rotate my tires. One Christmas, he gave me a set of socket wrenches that I did not particularly appreciate. And I want to relate this experience because I greatly valued what he taught me, because when my clunker of a car broke down when I was at the University of Texas at Austin, this car was pushed onto a side street, and it was in front of a frat house next to UT's campus, where I had the tools to fix this car, and I did. I actually replaced the fuel pump on this car in front of this frat house. And the members of this fraternity sort of came and went, and no one, not only did they not offer to help me, but they, some of them catcalled me. In fact, I remember one person saying, good job, grease monkey, was how he referred to me while I was fixing his car, because I was able to do it and it was relatively simple, but it took some time. And I learned from that my father was really, preparing me not to need help from anyone in terms of making me self-sufficient. And he gave me the tools to do that, both in my education and in the actual physical socket wrenches and things like that to do that. And I learned that I didn't need other people's help as much as I might have had I not been raised in the way that I was. But I also, from that experience, I didn't need the help of those frat boys, but it was one of the things that began to color my life's experiences. Previously, these may have been people who could have been my friends and whatnot, but I sort of began to see people attaching an experience with a small group of people to larger groups of people. And I think this is something that we may all tend to do and that we should all avoid in terms of being poisoned. But I'll tell a bit more about my experiences there at the University of Texas. There were probably 46,000 students while I was there, and only 1,000 of us were African Americans, and we had a very tight-knit community. It was then when all of this diversity and all these previous rich experiences sort of ended, and the different cultures there really did not intermingle socially at all for the most part. And this continued when I went to medical school. I was in my medical school class of 200 people, there were only 5 African Americans in my class. And when I went on to do my internal medicine residency, I was the only African American in my internal medicine residency training program in the 3 years that I was there. I was the only Black. And so it was during this time that I sort of began to question my abilities, because I looked at others in my class, many of whom had parents who were physicians, or they had done shadowing experiences in medicine, and they had been exposed to things that I believed gave them an advantage. And I really began to question my abilities, and I struggled with finding people to connect with and to identify with. And also in my training program, it was really, that was really the greatest sort of good old boy environment that I experienced. And I really began to question and in fact mistrust leadership. There were no mentors for me. There was, the majority of the faculty members were white men in leadership positions. There were few women faculty members. There were even fewer minorities. And so I really had few role models, mentors, or anyone to identify with. with the exception of one individual, and this was an experience that was sort of life-changing for me that I will relate because it framed my career. While training in internal medicine, I decided that I wanted to specialize in infectious diseases. And then when one of the infectious disease faculty members learned about this, he sort of took me under his wing and began mentoring me. And I was delighted by this experience because it was actually rounding with this attending that led me, that developed my interest in infectious diseases. Because when we rounded with this faculty member, he made every case sound fascinating in infectious diseases. And so it was the science and clinical part of it, but it was also the way that he treated people. He was sort of a self-professed Yankee from Vermont, and but he never made a disparaging remark about anyone. And as an example, when we would round with him in infectious diseases, we had a lot of patients who were injection drug users, and they were commercial sex workers. And so they frequently would leave the hospital against medical advice. And this particular faculty member looked at all these individuals, and while other people would maybe refer to the women as prostitutes and make disparaging remarks, he would say things like, well, this young woman is a commercial sex worker, has a very strong work ethic, and she had to leave the hospital against our advice in order to continue earning her living. This is the way he framed all the people that he treated, and I so admired and respected him. And so it was this particular individual, when he learned about my interest in infectious disease, who told me that I would be a much better infectious disease doctor if I understood public health. He had formerly been what is called an Epidemic Intelligence Service officer. This is an EIS officer with the CDC. And he encouraged me to apply to the CDC program to become an EIS officer. And it was my intent to do that brief 2-year stint in this CDC training program and then move back into clinical medicine. But that's what exposed me to public health, and I've stayed in public health ever since. So that single mentor, that faculty member, really did help me make a life-changing experience to move from clinical medicine to public health. And so I've been with DHEC now, as you mentioned, for nearly 29 years. I spent the bulk of my experience as a medical epidemiologist, but I have assumed roles of progressive responsibilities, and some might see those as leadership positions, but I have always preferred to really work behind the scenes. I was actually offered the position of state epidemiologist, which I originally declined because I did not see myself in that role. And I ultimately, a year or so later, I accepted the position when they didn't fill it. But I did reframe the position from the former state epidemiologist who had, the reason I declined the position was because he had such a prominent role in the national arena, participating in committees and things like that at the national level. And I reframed that position to fulfill what I believe I fulfilled the expectations, but I also fulfilled my own personal goals to work more at the local level, to focus more on health disparities in South Carolina. And I've always worked in communicable disease control, but I have kept that focus as you've mentioned. And so, most people are aware that it was the COVID pandemic that really thrust public health officials into the forefront. And that was not a position that, I would say that any of us desire to be in, but, and so I know this is supposed to be about leadership, but I will say that I'm not quite sure you can accept the title of a leader if people don't follow you. And there were many aspects of my role, I would say, like because of my most prominent role out of my 29 years in the last 2 years, that was somewhat discouraging, that no matter what we did in public health, that we could not get people to follow our evidence-based advice. And it was really disheartening that we in public health could not get people to understand or to even consider what agenda we might have in public health other than to protect the public health. So the distrust of the advice that we gave and those experiences were disheartening, but there were experiences that I did find quite rewarding, because I did, although I in my career historically worked behind the scenes in addressing health disparities, I do think I finally found a way to be much more vocal about how health disparities impacted all populations. If you're looking at a disease that can be transmitted from person to person, that affects us all, no matter where we live or where we are. We all share the same community. So I did feel somewhat rewarded by certain audiences who I feel were influenced by our messages. And I do think that we were able to do a great deal of good for some segments of the population. And I will say, particularly in African-American communities, I think my message was really better accepted. And I think that we made positive changes there. And I think we made positive changes in helping others recognize the impact of health disparities in a way that I was never able to do before. And the other thing that I'll say that I found most rewarding in that experience is, despite my long career in clinical medicine and public health and in epidemiology, it was really in the last 2 years that more young women, more parents of young women gave me a lot of feedback saying that because of my visibility, they themselves or their daughters were really seeking careers in medicine or seeking to become an epidemiologist, when really, prior to that, most people in this country, in fact, didn't really know what epidemiology or the basic science of public health or what epidemiologists did. So I'm really most rewarded and most encouraged by that outreach from young women who who said that they wanted to emulate the career that I had followed, because they thought that public health was a way to make a difference in people's lives. So then currently in my position as the director of the Bureau of Communicable Disease Prevention and Control, there are probably about 160 people who fall within my oversight. And it is just, in my experiences of observing or working with people that I admired and respected, that I have emulated certain things in my position as a manager and perhaps in a leadership position. But I also learned a great deal from people who were who held leadership positions, but they were self-serving, they were uncaring, and in fact, I worked with people who were actually vicious. And so from those people, I learned exactly what not to do in my role, because I think that many of them actually had little insight in how they affected other people. And so I'm just mentioning my rewards, my challenges, how I have framed what I've done in my career. And I will end my remarks there. I'm just delighted to have been invited to speak to you, and I'm happy to have a conversation with you if that's possible. So thank you again for your attention.
The usual need to unmute myself. Thank you so much. Gosh, you've really been out all over. I do remember during the pandemic how difficult it was for me personally to watch people not follow the suggestions and the rules. I mean, a lot of us, I'm sure everyone on this grouping, stayed home, wore masks, got vaccinated, and did as we were, was suggested. So I can only imagine what it was like to watch the administration from our governor's office take it so lightly. And it's very difficult. There is a question, and if you do have questions, please either raise your hand or post them, preferably post them in the chat. Dr. Bell will be able to see them there as well, and I can also read them out. Has the good old boys club culture in medicine and the scientific community changed over time, And how can we bridge the gender gap in public health?
That is a great question. And I will say that I think it has changed some, but not enough. Now, for example, one of the reasons that we have one of the contributors to health disparities, particularly in the South, is the lack of healthcare professionals who are minorities. And so the process of getting into medical school, being encouraged to go to medical school, there's still a great deal of work to be done there. And medical school is actually getting, just in terms of the financial perspective, paying for medical school now is much, much more difficult. I'll say that when I went to UT Southwestern Medical School, this is one of the system in Texas has one of the largest endowments in the world. And our tuition at that time was $1,200 to go to medical school. And my parents and I were so alarmed that every year that I was enrolled in medical school, the tuition doubled. So in my second year, it went from $1,200 to $2,400, and so on. And so by the time I graduated from medical school, it was something like, over $5,000 a year, and that sounded like a lot. Well, now a medical education, paying back those student loans costs hundreds of thousands of dollars, and the payback, the return on that investment for people to go to medical school, do the residency training and so forth is, many people don't see the immediate return on that, but many people choose against medicine. And we really need minority healthcare professionals, physicians, nurses, and so forth, especially to serve our rural communities. And so but the people in leadership positions who make those choices, who allow entrance to medical school, I think that there is still somewhat of a good old boy network. However, there's a greater recognition of diversity, equity, and inclusion. And so now most higher ed, most medical schools have offices now that focus on minority recruitment, beginning even in high school and college, to encourage that. So I think that we are, looking at a process of change. It's moving slowly but surely, and so I see that as one of my roles. Any opportunity I have to encourage someone about the variety of careers that someone can, or paths someone can take in medicine, not just in clinical medicine, but in other ways, in consultation and in private sector and in industry and things like that. So I think we all have work to do in that area, especially for young women and young minority women.
T Counts has a question. What was your cultural experience from moving to South Carolina?
So my biggest cultural experience was moving from big cities like Dallas to come to, when I said, well, I'm moving to Columbia, South Carolina, what's that going to be like? I came here because my husband is from Aiken, South Carolina. And the CDC actually agreed to transfer me in the second year of my training there to be an EIS officer here. And so, for people who are from the South, they may not completely understand the misperceptions of the South. I actually found it to be, the warmest and most welcoming place for the most part for my individual experiences. And as I mentioned before, had my father's perception from Brooklyn of my mother coming from the deep South. And I think I had a little bit of that moving to my husband's home in South Carolina. But when I look at my childhood experiences that I related to you and my husband's childhood experiences growing up in the South, he and I are only a year apart. And what he experienced as a child was really dramatically different growing up in South Carolina from what I experienced in West Texas. His older siblings all went to segregated high schools. They didn't integrate the schools in Aiken until my husband was, I guess moving from middle school to high school. And so those experiences, that diversity of culture, he did not have what I had. And he and his family experienced discrimination in a really sore way, and they prevailed and really overcame. But Aiken County was quite unique too, that a lot of industry from other areas. And so I think Aiken, from what he tells me, was a bit different from other communities in South Carolina in terms of being more diverse and more accepting. So I have, South Carolina is certainly considered it my home, and I'm glad that that we chose this as the place to raise our children.
Yeah, I have several friends that have moved here from other parts of the country, particularly up north, and they always say it's quite a culture shock when they get down here. And I've lived here all my life, and I even know that. So I can appreciate that experience. Does anyone else have any other questions for Dr. Bell?
Yeah, I do.
Go ahead.
So I've noticed that even in working in the same specific field for years in higher ed, I've had to change leadership styles. For example, I've worked in undergrad and two-year technical schools, and there was one leadership style. And now that I'm on the graduate professional side, I've had to switch up my leadership style. For you specifically, being an epidemiologist and then dealing with the pandemic, did you have to change your leadership style to mold to what was going on in South Carolina at the time? And even now, like, have you had to morph your leadership style or change it completely, or go back to what maybe something that you used to do in order to make sure that things were running smoothly and the message was getting out there?
Yeah, thank you. I think that I have certain qualities or characteristics that are innate that I don't change in my style of working with other people. But in other ways, I may change my leadership style based on who's sitting right in front of me, or based in the environment that I'm in. And I think you're saying maybe the same thing, that you've had to change over time. I think that maybe one of the biggest changes that I've made over time, though, is sort of smoothing out my rough edges. I work with a group of people. I mean, some of the closest people, some of my direct reports are some of the most caring, considerate, understanding people, and that has not always been my way. I mean, I've been told that I'm pretty assertive, that I'm pretty aggressive, that I sometimes have sharp edges. And in working with the people that report directly to me, who are always kind and considerate, non-judgmental, sort of tells me how I'm expected to behave in many ways. And so in that way, I think I've softened my approach, and I've been more understanding. I still can be assertive if I need to, and I have been. And the other thing I will say, though, is I also recognize that in my role, I speak for a state agency, and there are certain things that I'm expected to do, and certain things that I'm expected to say, and certain things that I'm expected not to say. And so there are often politics involved, and I have learned that when I must hold my tongue, and that there are ways to get things done without being assertive, that people are more willing to work with you when you are more accepting, open-minded, understanding, more listening, and not always focused on saying what you feel needs to be said, because it may not be the right time and you may not ultimately accomplish your goal. So I think I'm going all around Robin Hood's barn to say that I do have a leadership style that has changed over time to be more, I guess, conciliatory. But I've also found a voice and a way to convey things that might be hard for people to hear, but to say them in a way that they might be better accepted, and that you can get people to find a meeting ground, to find ways to work together, especially with people that you may not have thought you could possibly work with, and you find a common ground, and you work on what you can, and you may turn a blind eye to what you cannot agree on.
Another question from E.G. Oatman, Black. Describe the differences of practicing in public health versus private as far as patient priorities and goals.
Yeah, I think that, you know, private practice, you focus on the person in front of you, and you try to do what's in their best interest. And what we see in public health is that clinicians, you know, are trained to treat the individual's best interest, and sometimes the individual's best interest and the population's best interest are not the same. So in population health medicine, we really focus on what are the contributors to the overall health of communities. And sometimes that means making that some members of the community might need to make sacrifices in order to benefit other members of the community. And we also focus on looking at the root causes. You know, how did people get to where they were when they, especially when they have disadvantages for either chronic or acute health conditions. So the clinicians in clinical practice may be more prone to treat acute conditions, to give that prescription, but not look at the downstream causes, if you will, to help patients to understand how they could have prevented these complications to begin with. And one of the things that contributes to that is that physicians aren't compensated for their time to do that. I mean, they do what they get paid to do. They do what they get reimbursed to do. And unfortunately in medicine, there's not a lot of reimbursement for preventive health that could actually better change people's health outcomes. It could change the health conditions as populations as a whole much more cost effectively. And so those are some dramatic differences in how our compensation is set up that is in many ways a deterrent to people achieving healthy lifestyles, because we're not able to focus on how you should change your diet, how you should focus more on healthy living, how you should avoid substances like alcohol, tobacco, and things like that that are the greatest factors in poor health, but you can't treat those with a pill. And unless we find ways to treat those underlying causes and for clinicians to get compensated for those things, then we will always be stuck on quick fixes. And similarly in public health, unless we recognize the need to fund and to develop policies for the social determinants of health, we won't make advances as quickly as we could in changing community level and population health outcomes.
Is there a group of women that you have as a go-to for your circle of mentors that make an impact on your life? Is that something that you rely on for your own ability to lead?
I do. I mean, I have a sisterhood of people. We have different professional backgrounds, but we I have some of my closest friends are either in academics, also in medicine, in law, but in other state agencies. And so we managed to come together and support each other. We supported each other in raising our kids, but we have each other that we can talk to, that we can trust, that we can vent, that we can, sort of feel, when you're trying to make a difficult decision, what do you think I should do? That kind of thing. And that is one of the greatest, that support system is one of the greatest benefits, I would say, in my relationships. I rely greatly on my husband and things like that. He's a tremendous support to me, but it's not the same as this sisterhood. This is just a different kind of understanding. And these are women who are very accomplished, but they're also just very understanding and very supportive, very loving and very nurturing. And I trust them greatly, and I am ever grateful for the gift that they are to me.
Another question from Jackie and Emmett. What's your thoughts on serving as a leader in politics and your core values?
Yeah, politics are so interesting to me because politics always seem to involve sacrifices that maybe many politicians are not willing to give up of themselves to ultimately make a difference. I mean, I confess that sometimes I have to question what is the role of politics in serving the community? I believe in things like term limits, because I think that if people, couldn't stay in office for a long time, that they would really focus on what they could get done and not focus on a career in politics. I do have questions about that. And so in my core values, I think that compromise is really important, and that you can't get much done if you really, really get dug in, and you only you will only accept what your specific interests are, and you're not willing to listen to others. And I just think currently in politics, I'm not sure that enough of that compromise, that listening to others, that looking at the greater good is as big of a focus as it really needs to be right now. I'm not really sure if I answered that question, but that's a really tough thing to think about nowadays and to address.
Sarah Pope has, how challenging were the press conferences during COVID?
I'm sorry, so how were the press conferences?
How challenging were the press conferences during COVID? That's a really good question.
That's a really good question, because they were absolutely unnerving for me. There's nothing, I just absolutely, as I said, I always wanted to work behind the scenes. I never relished being, on camera, being in the forefront. I was always very concerned about, we had the talking points that as COVID was evolving, the messages that we wanted to bring to the community about what was going on, what needed to be done, how we saw things, the whole national picture. And I felt, very well versed in that. But I was always most concerned about the questions that I would have to field. What were they going to ask me that I might not have the answer to? And so often there simply were no answers. I mean, we were learning as we went along, and we were expected to make projections and make predictions, and we couldn't do that in many respects. And I'm sorry for how that may have contributed to mistrust, where people said, well, they don't know what they're talking about. Well, there were simply things that we could not have predicted. And in particular, we could not have predicted human behavior. So the things that we really thought were going to happen, that we could have had control over, simply did not happen because of human behavior. So I was really unnerved in most of those press conferences by, what I could say, what I should say, would I step over the line, would I, say the wrong thing as a representative of the state agency, and would I find the right message to help people understand, to make decisions in their lives that could really have changed literally their lives, that could have saved lives. And so that was the thing that I most wanted to do. And I always questioned, was I making a difference, and was I accomplishing that, which was my ultimate goal.
Lisa has a question. Your description of your journey definitely resonates with me. I would concur with the fact that having good, open-minded, and empathetic mentorship was also important in my journey as a therapist at Fort McPherson, Atlanta, Georgia, at the time, originally from Brooklyn and moving around also as a military spouse. Moving to South Carolina over the past 2 years and being called a Yankee, which is in my mind a pejorative now, was shocking, but due to mentorship I received as a clinical intern by 2 white males taught me to hold my own in a boardroom. I believe that Black women are often seen as aggressive, but rather than we are purpose-driven, it is taken as assertive also. Thank you for telling your story. And just as you stated, I now build my rapport and then state and act on my passion in mental health, holistic approach. Moving forward, where do you see the most important concerns will be with the initiative of 988 and its impact locally?
I'm sorry for this, but you'll have to tell me what 988 is.
I think that's a mental health hotline. Lisa, can you unmute yourself and elaborate?
Yes, ma'am. It's the new mental health helpline. Instead of calling 911 for an emergency, you'll call 988, which is actually national. But I wanted to know, what do you think the impact will be locally for South Carolina with that?
You know, I'm so delighted to hear about that because many people may not appreciate the mental health impact of COVID, the isolationism, the loss, all these things that what we've seen in our children, what we've seen in people who were separated from socialization. And even in my workplace, I had many of my colleagues who really experienced burnout and who actually needed acute emergent mental health support. And one of my coworkers found that in a national hotline. And I think this is a different thing because that coworker actually told me what the helpline was. We have a desperate need for more mental health professionals and more mental health support, and for the ability for more people to talk about how much they're struggling with mental health situations. It's stress, anxiety, isolationism, depression, recovery, and I know many people who have come to me personally who have been afraid to talk about that, and some who I've referred to mental health professionals saying, you know, I'm glad you let me know this. You need help to make it through this. And there are so many people that are in this position. So in short, I've made a note of it. I'm glad to learn about this because I'm in a position where I encounter a lot of my staff who struggle and need that kind of assistance. So I hope that you know, I will certainly play a role in promoting that, and I think that it will have a huge difference because we do have a shortage of mental health professionals, as I've learned from people who needed acute emergent mental health care and could not find it when they were having suicidal ideations.
Going back to sort of the COVID situation, the press conferences and politics, do you find, or did you find, and are you seeing currently, that the divisiveness within politics are costing people their lives due to the lack of empathy and concern about more of a, I guess what I'm looking at is more of the concern to keep businesses open rather than protecting the public health?
Yes, divisiveness, I think, is affecting people's lives. This is something that's really unique about COVID. This is something that I've never seen before in previous pandemics, previous large outbreaks, that we've never seen a disease that actually followed ideologic patterns, that you could look at disease activity not by its geographic distribution, but by the predominance of how people voted in different areas. In South Carolina, at the county level, nationally, at the state level. So when public policies were made based on the focus on public health, we refer to these as jurisdictions because we look not just at states, but at large cities, places like Los Angeles, New York. We consider these all jurisdictions. And so, for example, in New York City, where my daughter lives, and I visited her, I was so impressed by how people behaved in New York City, that the universal use of masks in every setting, the acceptance of having to show proof of vaccination in every restaurant that you enter, that people on the subways would say to someone openly if they didn't have on a mask. You know, I actually saw a guy who saw a homeless guy who said, you know what, if you need a meal or something, I'll buy you a lunch, but you need to put a mask on. And everybody on the train would have on a mask. So the difference in those cultural experiences, the attachment to ideologies, you know, it helped New York recover from the largest disaster of COVID that overwhelmed their healthcare systems. and made them one of the most protected communities to a place here where we continue to be at risk because we simply could not accept that, a simple thing like putting a cloth over your face to prevent respiratory droplets falling on your neighbor was, the ideological resistance to that killed people.
Yeah. Yeah, I agree with you. I just kind of wanted to hear your perspective because it must have been incredibly difficult to stand there time after time and do the press conferences and just feel somewhat, I know I would feel helpless because, you knew that people were just not listening to what you were saying because of ideologies. Are there any other questions that anyone might have? We're getting close to the end of our hour. If not, we're going to, I thank Dr. Bell. That was very interesting. I loved hearing everything you had to say. It was very helpful. We appreciate your time and your energy, particularly during the pandemic. Ladies, have a great holiday season. Enjoy your families, and we will see you next month. I will, as soon as we have a speaker for January, we will announce it. If you know of anyone, please send an email to Emily or myself, and we will jump on that. We're still looking for our January speaker. And as usual, we will meet the first Tuesday of the month from 12 to 1. We keep it at an hour. And as most of y'all know, we start on time and we end on time. Sometimes we end up a little bit early. So thank you so much for everyone who joined us. Emily will send out a recording of this to all who could not attend or who would like to listen to this again. And I appreciate all your time and your energy. Thanks again, and good night, good afternoon, and have a great rest of your week.
Thank you so
Thank
very
you. Merry Christmas.
Happy holidays.
Thank you so much. Appreciate it.
Mhm.